Hi, my name is Luis Paladines, and in this section, I'm going to talk about congenital syphilis. Congenital syphilis is a multi-system infection caused by the Treponema pallidum germ and transmitted to the fetus through the placenta.
Congenital syphilis. Congenital syphilis is a problem in parts of the world where women do not receive prenatal care. T. pallidum can be transmitted by an infected mother to the fetus in utero. In untreated cases, stillbirth occurs in 19% to 35% of reported cases. 25% of infants die shortly after birth. 12% are without symptoms at birth, and 40% will have late symptomatic congenital syphilis. The fetus is at greatest risk when maternal syphilis is of less than 2 years duration. The ability of the mother to infect the fetus diminishes but never disappears in latent stages. It can, however, occur at any stage of infection in any untreated or inadequately treated mother. The risk of fetal infection decreases after the early stages. Infection of the fetus before the 4th month of gestation is rare. Treatment of the mother during the first 4 months of pregnancy usually protects the fetus from infection. Thereafter, abortion, stillbirth, neonatal death, neonatal disease, or latent infection are all possible outcomes.
Application in medicine. Studies affirm that congenital syphilis is rich in Treponema pallidum, and therefore its direct investigation is an important auxiliary to confirm the diagnosis. This is done by dark field technique that is useful, especially in those cases where the levels of antibodies are not detectable. Despite the specificity of the diagnosis, the most widely used tests at present are indirect examination, which detects antibody in an average time of 4 weeks after infection.
Good morning, I'm David Anderson from the Burnett Institute in Australia, and our goal is the elimination of congenital syphilis, which affects around 650,000 babies each year, as well as contributing to about a quarter of all stillbirths. And all of this could be prevented by a simple shot of penicillin administered to the mother. But first we have to diagnose those mothers who have active syphilis, and this requires 2 different laboratory tests. One of them has been developed as a point-of-care test in the past. We've now developed a simple point-of-care test, just like a pregnancy test, for the second test that can confirm who has active syphilis. And our project aims to integrate the 2 tests together, again into a simple point-of-care test, and then do large-scale laboratory-based validation studies with our partners at the National Centre for STDs in China. And this will allow us to integrate the new device into the existing public health policies of the countries that are most affected. Thank you.
Pros and cons. As proof, we have that all pregnant women undergo during the first pregnant visit, regardless of the trimester of gestation. The VDRL tests, which are not treponemal laboratory tests, useful to make an initial diagnosis of syphilis, which is confirmed when treponema tests were positive of when the presence of Treponema pallidum was identified in the biopsy of the suspect tissue or fluid. As cons, we have a higher mortality rate, signs up to half of all babies infected with syphilis while in the womb die shortly before after birth. Problem apply in Ecuador. Congenital syphilis remains an important public health problem. It is still not possible to satisfy prenatal care, despite the increase in courage. The action implied show low effectiveness in its prevention. Overall, the WHO estimates that most maternal syphilis infections are untreated and have a high enough tier to cause significant fetal exposure to Treponema pallidum.
Congenital syphilis is when a pregnant mom has syphilis and transfers it to her baby. The Public Health Department showing this chart today. As you can see, this is from back in 1995. Little to no cases all the way up until we reach 2011, where we start seeing a sharp increase. The Health Department defining the rise in the disease as an outbreak.
Since 2012, we've had 171 infants born with congenital syphilis.
And that's why the Kern County Public Health Department helped spearhead a special summit on Wednesday aimed at bringing local health providers to discuss combating the growing problem of congenital syphilis, which is when a pregnant woman has syphilis and passes it to her baby. Medical students also sitting in and learning from the summit.
I'm shocked and sad because, like I said, this affects a vulnerable population. Babies, they come into this world and they're already sick and suffering.
Although congenital syphilis is treatable, infants that survive can have long-term effects including bone deformities and seizures. Kimberly Hernandez is an epidemiologist with the health department and spoke at the summit.
Historically, if you're looking back into the 90s, we had no more than one case of congenital syphilis a year. Many years we had zero. And so we're working really hard to get back to that because congenital syphilis is preventable.
Syphilis is easily treated with penicillin, and Hernandez says if a mom is treated within 30 days of delivery, it can prevent the transfer of the STD to her baby. Although the earlier in the pregnancy, the better.
Last year we had 56 cases of congenital syphilis. That's more cases of congenital syphilis than we've ever had in Kern County in the history of syphilis that we know of.
So why are we seeing a growing trend if it's so easy to prevent? Hernandez says it's hard to know an exact culprit, but today's summit included talks with organizations that help those who might have a hard time getting prenatal care.
For substance use, as well as homelessness and domestic violence, as well as we have representatives from various health insurance companies, because a large piece of this is, paying for, testing and treatment.
Now the health department says if you're sexually active, you can do your part by getting tested regularly so that STDs do not spread. In the Live Center, Austin Westfall, 23 ABC.
Conclusion: congenital syphilis is an easy social medical problem to treat if it is diagnosed and treated properly. So it is necessary to train the doctors who carry out prenatal control and those who receive newborn in hospitals to decrease the record and cases of inefficient and untimely treatment.